everyone understands this, but here's a list of joint conditions that can unexpectedly be discovered in healthy individuals. Hello everyone, I'm Dr. Boisvert, chiropractor. In the world of healthcare, surprising truths sometimes emerge unexpectedly. Imagine being in perfect health, only to have a medical test reveal a previously undetected degenerative disease. Faced with this new reality, you decide to change your lifestyle habits. But unfortunately, you may not realize that you're making the biggest mistake of your life. I can't believe how many therapists and even physicians still make this error. Osteoarthritis is a condition that is often misunderstood, but more importantly, is widespread, affecting millions of people worldwide. Whether you're young, old, active, or sedentary, this progressive joint degeneration can significantly impact quality of life, especially if you let it take over. The smooth cartilage covering the ends of bones may thin over time, leading to increased friction between the bones. This can result in pain, stiffness, and reduced mobility. However, osteoarthritis is often overdiagnosed. Here's an unpopular opinion. Many therapists and even doctors fail to understand that just because there's pain in a certain area doesn't mean medical imaging is necessary. And more importantly, it's entirely possible to have osteoarthritis and pain without the osteoarthritis being the cause of that pain. Otherwise, patients might end up thinking their health is worse than it really is, which could lead them into a sedentary lifestyle out of fear of worsening the perceived fragility created by the overdiagnosis of osteoarthritis. Stop believing that your pain is the result of a herniated disc. In fact, spinal hernias, whether they are overdiagnosed in the cervical, thoracic, or lumbar regions, are often incorrectly linked to your pain. Unfortunately, many people mistakenly confuse a disc hernia with disc-related pain. The intervertebral disc is innervated by pain receptors, just like many other parts of your body. But for a herniated disc to be considered a serious contributor to your symptoms, it must cause neurological dysfunctions, such as affecting strength, reflexes, or sensory loss, due to nerve root compression caused by the hernia. Another thing I wish I had learned earlier during my doctoral training is that, while the shoulder is a fascinating and complex joint designed to allow an incredible range of motion, this very mobility also makes it highly susceptible to degenerative processes. What's surprising, and something I wish I had known sooner, is that many degenerative changes in the shoulder structures, such as the tendons, ligaments, and bursa, can occur gradually, or even be present without causing any symptoms at all. Let me give you a few examples. The thickening of the subacromial or subdeltoid bursa, for instance, is a condition where this small fluid-filled sac, which helps the tendons move smoothly, becomes degenerative and thickens over time. Or consider the degeneration of the acromioclavicular joint, where the cartilage between the acromion, part of the shoulder blade, and the clavicle wears down. Then there's rotator cuff tendinosis, where the tendon of the shoulder muscles, most commonly the supraspinatus and subscapularis, undergoes degeneration. This reality raises important questions about the nature of pain and the importance of avoiding hasty conclusions from these incidental findings. I often see patients diagnosed with such conditions after a minor work injury, which unnecessarily affects their autonomy and leads them into treatments that carry more risks than benefits. If you knew everything I've learned about the degenerative processes of the knee, you'd never look at this joint the same way. When we dive into the complexities of the knee, it becomes clear that this vital joint, just like others in the body, is not immune to degenerative changes. These conditions are often overdiagnosed or misinterpreted and can have serious implications for quality of life. For example, incidental findings of cartilage or meniscus damage, osteophytes, bone spurs, or even bone marrow lesions can be misleading. Bone marrow, by the way, produces blood cells like red and white blood cells and platelets. But here's the key point. All these degenerative processes don't necessarily mean pain. Even if they're found by accident in your back, neck, shoulder, hip, or knee, they shouldn't be a reason to stop being active. If you give in to a sedentary lifestyle and start cutting out activities that cause discomfort, you'll end up feeding a cycle of persistent, chronic pain where everything becomes harder to accomplish, right down to clicking your computer mouse or tapping your phone screen. Speaking of which, don't forget to click the subscribe button and the notification bell to stay updated on all my future videos.